Hi everyone, this is Jennifer Burns. This is Module 7 and I am going to be administering oral and an IM injection to Millie Larson. So one of the first things that I'm going to do is I am going to look at the MAR of patient Millie Larson with the date of birth of 1/1/1936, and I'm going to look at the meds to be administered. This is Practidocusate, 100 milligram tablet orally. Due now for constipation and to soften stools. The next medication to be administered is Practi-Haldol, 2 milligrams via IM injection. Due now, and this is to control agitation, and this is going to be given via the ventral gluteal site. So I am going to perform hand hygiene. As I was looking at the chart, the MAR, I noted that Miss Larson does not have any allergies, no known drug allergies. Cleanse my hands. I'm going to gather my supplies. I have my Band-Aid for the injection, alcohol pads to clean this side and clean the vial. If needed, I have a 2x2 gauze. I have my supplies for the IM injection, my medication cup, and a cup of water. All right. So now that I have all of my supplies, I'm going to gather my medications now. I'm going to note Colace, 100 milligram tablet orally, and I'm going to pull from the medication cabinet Docusate, 100 milligrams. I'm also going to take Haldol via vial from the cabinet. She is to get Haldol, 2 milligram via IM injection. All right, and I'm going to double check the medication 2 more times against each other. So Practidocusate, 100 milligrams, 1 tab orally. Practi-Haldol, 5 milligram per ml. She is to get 2 milligrams. I'm going to be administering 0.4 mLs. I'm going to check expiration date. So Colace expiration date is June of 2023, and Haldol expiration date is June of 2029. All right. So when I enter the room, I'm going to have my Colace in the cup like this until I'm ready to administer it to Miss Larson. I will draw my injection at bedside. I'm going to enter the room. I'm going to introduce myself to Miss Larson as Jennifer, the RN caring for her. I am going to list the medications, the strength, and the reason she is getting those medications. I'm going to assess for pain. And I am going to ask her if she has any pain. I am also going to ask her her name, date of birth, and ask her to confirm any allergies. And I'm also going to look at her wristband to assess her name, date of birth, and any allergies that might be listed on her name band. So now what I'm going to do, I'm going to sanitize with a hand rub. I am going to take the medication from the pill packet and I'm going to place it in the med cup. For the injection, I'm going to uncap the vial. I'm going to clean it with alcohol for 30 seconds. I'm going to prepare the syringe. This is a 22 gauge syringe. All right, I'm going to take care not to touch the tip here on the end. I'm going to draw up the air needed. Again, I'm going to administer 0.4 mLs. I'm going to insert the needle into my vial. I'm going to instill the air from my syringe into the vial, pulling back the medication. Okay. So I have here 0.4 mLs of medication. I am going to provide privacy to the patient. Close the door or close the curtain. I'm going to hand sanitize one more time. I'm going to administer her the oral medication, making sure that she is sitting up in a high Fowler's position to take the medication. Once I am done administering the oral medication, I will make sure that she lies down in a side lying position. Again, making sure that privacy is provided. I am going to, for the hip injection, the ventral gluteal injection, I am going to lay her on her side, legs straight, as best possible, and try to ensure comfort. I am going to palpate the greater trochanter and place my palm on the greater trochanter. I'm going to feel the iliac crest and feel for the iliac spine, creating a triangle. So my index finger will be on the spine, and my middle finger will be pointing over toward the crest, and my injection is going to go right into the middle of the triangle in between my two knuckles. I have wasn't able to get an orange, but I have a stress ball that I'm going to use for my injection. All right, so just bear with me. Let me see if I can pull this over so you can see. Sorry, I'm at work and I'm using boxes as a stand. All right, so sanitize my hands. I'm going to don my gloves. All right. I have found my injection site by the method stated. So now what I'm going to do is here on the stress ball as best I can. I'm going to hold my hand in place. I'm going to clean the skin. I'm sorry, I know it's hard for you to see. I'll hold the ball up. So I'm going to clean the skin for 30 seconds, going in all directions. so I'm going to leave my alcohol pad there just to mark the site. All right, so now that I have my syringe, again, this is 0.4 mLs of Practihaldol. I am going to remove my alcohol pad, being careful not to touch the site there. I'm going to, in a darting motion, inject the needle into the skin. All right. I'm going to pull back on the syringe to aspirate for blood. I did get return. So now I'm going to inject the medication. All right. I'm going to pull the needle straight out. I'm going to immediately sheath my needle. I have a Sharps box container next to me, so I'm going to dispose the needle into the Sharps box. And I'm going to set my patient down for just a moment. And I'm going to open my Band-Aid, and I am going to place the Band-Aid right over the injection site. All right, so now what I'm going to do is I'm going to remove my gloves. I'm going to dispose of them. I'm going to wash my hands. And I'm going to clean up my mess and dispose of all of these materials appropriately. Any blood-containing products I am going to also put into the Sharps box. All right, and so now I can document on the MAR the interventions I've done. All right, so I'm going to initial administered under Docusate and Haldol. For the oral medication, there is no injection site. However, for the Haldol, I'm going to put ventrogluteal. I am. Site assessment, that's not needed. Site data is not needed also. So this is what it would look like. I have initialed and I have noted over here. I'm going to sign the bottom and initial. All right, guys, thanks. Don't be too hard on me. I don't like videotaping.